Hello everyone, hope you're all well and fine. It's been over a week since the government ordered a shutdown and we have all been restricted to our homes. The outbreak of novel coronavirus 2019 has been recognized as a pandemic after the Spanish flu in 1918. Originating from Wuhan province of China, it is now leading to a global lockdown and reported cases of over 4.5 lakhs infected patients with 21,000 deaths worldwide. And as of today, 26th March 2020, just 1,300 fatalities in Italy and Spain alone in one day, and reported cases of 1,796 patients in Malaysia with 20 deaths and 64 critical or serious patients. The novel coronavirus has truly become a major uh, threat. This presentation is a brief introduction to the novel coronavirus and COVID 2019. Please note that this video is just for education purpose and creating awareness among us, so as health workers we can better understand the situation that we are in. To start off with, first let's get the terminologies clarified. The nCoV 19 stands for the novel coronavirus, which was discovered in the year 2019. It is named as novel because the strain of this type of coronavirus has never been identified before, and the disease that it leads to is called the COVID 2019. So let's just go back and refresh our memory a little bit about the viruses. So virus is generally an organism which consists of a protein capsid which encloses a DNA or an RNA. This protein capsid can sometimes be made of lipid, and it's mostly non-parasitic on humans. We have to understand the diseases caused by viruses are mostly zoonotic in nature. And when it comes to coronavirus, it's a type of an influenza virus which has already transformed into various forms, and we know that it has we know the variants such as SARS, MERS, and presently the novel coronavirus. All of this have seemed to have the tendency to attach itself to bats, from which it has transformed or transmitted to an intermediate vector. In terms of SARS, it is a civet cat, and in terms of MERS, to the camel, and in terms of COVID-19, it's pangolin. So, as we all know, SARS stands for Severe Acute Respiratory Syndrome 2003, and MERS stands for Middle East Respiratory Syndrome, which occurred in the year 2012, with a mortality rate of 34% and 10% for SARS. And currently, the novel coronavirus, uh, which stands at a rate of 3 to 4%, which is changing every day. Now, we are not new to the idea of viral infections spreading from animal to humans. If we remember past, and if we refresh our memory a little from microbiology, we can remember that the transmission of human immunovirus HIV came from rhesus monkeys. Swine flu was identified to have been transmitted from bats to birds, birds to swine, swine to humans. So this is not a new concept. Only difference here is that over a period of time, this influenza virus has said to have evolved into various different forms and is finding a way to affect human beings. Now, the fact that pangolin being an intermediate vector in terms of uh, COVID-19 is still being investigated and it has not yet been confirmed, but is considered as a fact. And how these vectors, how this virus gets transmitted from these vectors to humans is still clearly unknown, but to some extent it is understood that the scales of this pangolin are used in various traditional therapeutics, which is consumed by humans. And uh, and another interesting example is that the civet cat, which was an important vector in SARS. um, the droppings of the civet cat, which has been fed with coffee beans, is a very popular, and which is one of the world's most expensive coffees that is being produced in the world. And in Middle East, we can understand that camel meat is one of the most uh, important commodities when it comes to food. So the transmission from these intermittent vectors to humans, there are various routes at which it is, although it is not very clearly stated or understood in terms of corona or COVID-19. This is the current theory we are working on. Now there are various controversies that are going around the infection and spread of coronavirus. Uh, but they do not have any substantial backing. And this presentation is only going to retort to scientific facts and evidence-based studies. So, how did this particular virus get discovered only in 2019? It has come out, scientists have come out with a theory explaining that the normal influenza virus has mutated over and or evolved over to the current coronavirus form. And this reason for mutation or evolution can be influenced by various factors such as radiation, sunlight, and external environmental factors, and which is further to be investigated and to be now, when it comes to humans, it is mostly understood that the mode of transmission is through majorly due to inhalation, the respiratory route, and due to ingestion, which could be the fecal-oral route. And this could be from a previously infected person or a person who is just acting as a carrier. We all know, when we study viral infections, we all know that virus has a latency period, and they do not necessarily infect and manifest as disease in all the patients. In some cases, it just acts as just mere carriers, and that remains true in this case too. What we have to remember is that the virus needs to attach itself to some molecule. It could be droplets, uh, water droplets, or some form of surface. It is said that after a person, infected person, sneezes or coughs, that particular area remains. The droplets can be carried in that particular environment for about 3 hours. So anyone passing through can contract the virus from those infected droplets. And when we talk about transmission, there are two important things that we have to remember. One is the R0, which is called the reproductive ratio of the virus, which generally translates to uh, how many persons can one person potentially infect. In terms of coronavirus, it is considered that one person has the potential to transmit this. One infected person can potentially transmit this infection to 2 to 3 other people, and this further gradually progresses. 3 can progress to 9, and 9 can progress to 27. And similarly, if we take a simple influenza virus, it is just 1 is to 1 person. So the R0 rate is just 1 is to 1. Whereas in coronavirus, it is 1 is to 3, and 3 is to 9, and 9 is to 27. And another phenomenon that we have to keep in mind is the series interval, which generally translates to the symptoms between the person who already has the infection and to the starting of symptoms from the person who has been infected from this other person, which generally translates to 5 to 7.5 or 8 days in terms of coronavirus. So these two phenomena, considering these two phenomena, the spread of this coronavirus, although is not as virulent as influenza, but the numbers, since the increase in numbers in the R0 rate, it has the potential of spreading way beyond control. This is an electron microscope picture of the coronavirus, and like we discussed before, if you notice well, there is a protein caspid and there is a single stranded RNA present within the protein caspid, and there are certain projections that come out of the caspids which are called the virions, which play a very crucial role in terms of coronavirus. We'll see those in the consecutive slides. As you can again see in this pictorial representation, this virions or the spike protein is basically constructed of S-glycoprotein, and the protein capsule which we spoke about, which mostly is constructed of proteins. In rare cases of virus, it is constructed of lipids also. In this case, it is constructed of M proteins and E proteins, which envelops within the single-stranded RNA material. Now, understanding the structure of this virus is very essential for us to understand how this disease is able to attach itself to us human beings. Coronavirus, in case of what happens is that this S-glycoproteins attaches itself to the cell surfaces of within the alveoli of the lungs, and this S-glycoproteins has an affinity to attach itself to something called as the ACE2 inhibitors on the self surface of the pneumocytes. There are two, if you remember well, there are two types of pneumocytes within the alveoli of the lungs, type 1 and type 2, and the type 2, which is important in terms of uh, producing surfactants, produces something called as ACE2 inhibitors, and this S-glycoproteins of the virus which are present on these virions have an affinity to attach itself to these ACE2 inhibitors. After this, what happens is that it goes through a process called cytosis, where the virus is engulfed within the cell and taken inside. This process further leads to engulfing of the virus within, and when it is within the cell, it releases this single-stranded RNA within the cell, and it uses the ribosomes within the cell to produce polyproteins, and it also uses uh, the RNA dependent RNA polymerase to further make replicas of this virus within the cell, and then later on destructs the cell through another process called exocytosis, thus leading to multiplication of this virus well within the cell structure. Now, understanding this particular mechanism of the virus to attach itself to the cell structure plays an important role when it comes to understanding the symptoms or the disease it can manifest and how we can intervene this process in terms of treatment. As I told you before, the cells, the pneumocytes, the type 1 and type 2. Type 1 plays a major role in terms of gaseous exchange, and type 2 basically consists of surfactants which are important in terms of maintaining the pressure within the alveolus where this exchange happens, and this coronavirus tends to affect these type 2, these surfactants, because of which as a process there is a possibility that the entire alveolus might collapse, and because of which there is increased edema, edema, collection of inflammatory material within this alveolus, and increased capillary pressure in that particular region. There is a very high possibility of developing pneumonia, which is infection of the alveoli and fluid collection within the alveoli, and ARDS, which translates to acute respiratory distress syndrome due to destruction of or collapse of the alveolar structures, which can eventually lead to septic shock. And this can also further progress to damage various other vital organs such as the kidney and the liver. And when we talk about the COVID disease, the coronavirus disease, there is something called as comorbidity in patients who already have an existing cardiovascular disease, diabetes, age factor, which we'll discuss further as we go on. The study of the infected Chinese patients provides us major data in terms of understanding the clinical features of uh, COVID-19. In 98% of patients manifest with fever, and about 76 patients of patient manifest with cough. 44% of patients have shown myalgia, which translates to muscle pain with fatigue, and 28% of these patients manifest with sputum production. There is headache in about 8% of patients, and hemoptysis, which is coughing of blood, in 5% of patients. In terms of patients with multiple organ involved or ingestions, it causes diarrhea in 3% patients, and most of these patients, especially in critical and severe stage, show signs of dyspnea, which is difficulty in breathing, which translates to about 55% of patients. And clinically, we can also observe that these patients have an increased respiratory rate and an increased heart rate. A lot of these clinical features mimic a simple flu, a common cold also, and sometimes even the upper respiratory tract infection. For us, it is very important to distinguish between common cold or upper respiratory tract infection and COVID-19, because most of these symptoms, thus leading us to investigation of this particular disease. To start off with, we can simply do a nasopharyngeal swab, um, and examining the culture, and we can also take an oropharyngeal swab, which is the first and basic most investigation that is performed. The ideal investigation that can be done is a real-time PCR or polymerase chain reaction, which has a sensitivity of 30 to 80% in these cases, but is a little expensive and also a little time-taking procedure. This procedure can be carried out with our sputum or aspirate or blood serology. And further down, we can also perform something called as a NAT test, which stands for nucleic acid amplification test, which is to identify a particular species, done on nucleic acid sequence to detect and identify a particular species or subspecies of an organism. It is a very expensive test, but considered very confirmatory, which is done at very later stages. In the meantime, a regular blood investigation can be carried out, such as CBC, where we can identify that there is an increased amount of which increased amount of CRD, ESR, interleukin 6, LDH, ferritin, and D dimer. And significantly, especially in these cases of COVID-19, it has been shown that there is leukopenia, that is reduction in very early stages, and specifically lymphopenia, which is reduction in lymphocytes. And further, in the meantime, when we are awaiting the results of PCR, which, like I said, can take some time, we can also resort to imaging studies, where chest X-ray is considered the most basic imaging study, where you can see ground glass opacities. If we can refresh our memory a little bit, we study these types of distinct patterns that are formed in imaging studies. We have studied that in OPGs, IOPAs, where we have studied soap bubble appearance, ground glass appearance. Similarly, in chest X-ray of COVID-19 patients, you can observe a distinct ground glass opacity with consolidation in the peripheral lung area. And the best imaging modality that can be done is CT, a computer tomography, where we can see all the above said features, that is the ground glass opacities, consolidation in the peripheral lung fields, and also, apart from that, a distinct pattern known as the crazy waving pattern, which is observed in terms of COVID-19. Apart from this, an ultrasound can also be performed, where you can observe pleural line thickening, increased B lines, that is in a specific zones, consolidation, and air bronchograms, which are distinctive to this particular disease. Apart from this, you can also conduct, in case of multiple organ involvement, you can also conduct serologic and imaging studies for various other organs also, which shows increase, which can, in terms of cardiovascular disease, can show increase in CKMB and troponin level. We can top this up with liver function tests and renal function tests to, in case of multiple organ involvement, and to study if there is any failure of other organs also. Now, a rapid kit has been developed where there is a certain response of IgG IgM recognized in terms of coronavirus infection, which has been used to construct a rapid test kits, which is pending approval in a lot of countries. Although a few countries have already approved this as a mode of testing to find out if a patient is nCoV-19 positive or negative. Which brings us to the treatment of the COVID. We can separate this treatment part into two categories. One is the preventive part and another is the therapeutic part. What we are currently following is the preventive part, which follows self-quarantine or isolation. It is important for us to protect ourselves from shedders. There are category of people who are being infected or who are being carriers. They are generally termed as shedders and super shedders. We all know virus at its most virulent stage has the possibility and probability of spreading more and infecting more. So it is important for us to protect ourselves from these super shedders, which can be done by isolation and self quarantine, and wash and sanitize our hands as much as possible because of for contact with surfaces, and avoid touching the mucous membranes, that is called the T zone of the face, which includes the eyes, nose and the oral mucosa, the mouth. Avoid touching it with our hands or without washing our hands as much as possible, and avoid any travel to countries where it is more prominent and where the number of incidents is too high. Moving on to therapeutic management. To start off with, patients are first given intravenous fluids, but it is done at a it is done very sparingly, as too much of intravenous fluid can again increase the edema buildup in the pulmonary region. So solutions such as the ringer lactate and normal saline is given to maintain nutritional and fluid balance in the patient. And fever, which is another important symptom of COVID, can be dealt with Tylenol. And to treatment of the COVID itself, the drugs that are used are remdesivir, which is marketed as Gilead, which is in stage 3 clinical trial and which has been prominently used in China to treat patients with coronavirus. It has already been used to treat Ebola, and this particular antiviral drug, what it does is it prevents the RNA dependent RNA polymerase, which is very important in terms of the virus to multiplicate within the cell structure. Is used predominantly, has been the most preferred choice of treatment. And apart from that, as we all know, which has been projected by the United States, chloroquine is another important drug that is being used to treat COVID. How chloroquine helps us in treatment of COVID is by inhibiting entry of the virus into the endosome. When we talked about this, how this virus affects the cell, we came through a process called endocytosis, where this virus gains entry into the cell. Chloroquine tends to inhibit this entry into the cell. Although it is a little bit of on the wall or controversial, because a lot of governments are issuing strong statements and being very careful in terms of using chloroquine as a mean of a treatment for COVID, because it has a lot of side effects, including increasing chances of infection. Chloroquine is generally combined with another drug called as the ritonavir, which is generally a protease inhibitor. Protease is an enzyme that is very essential for this virus to create or to manufacture a capsule for itself when it replicates within the cell. So ritonavir plays a major important role in inhibiting these protease enzymes. So it is generally given as a combination with chloroquine. In most of the cases, chloroquine is generally was previously used to treat malaria, and it has also been used to treat in certain cases of SARS. Apart from this, another drug which is known as tolizumab, uh, which blocks the interleukin 6, which uh, leads to the buildup of pulmonary edema, is used in terms of ARDS, and corticosteroids are also carefully used to bring down this inflammatory response within the alveoli. The manufacturing of vaccine or the creation of vaccine is still under trials, and we cannot expect it to come out in market at least until 2021. And the another important manifestation of this coronavirus is the ARDS, which is the acute respiratory distress syndrome, which this COVID leads to, which is the widespread inflammation of the lungs. So this particular condition is treated with mechanical ventilation and interferons, and the drugs, as I mentioned before, to decrease and increase the respiratory rate. When a patient manifests with ARDS, the death rate of the or the chances of mortality increases to about 35 to 50%, where the COVID infected person is categorized to a very severe or critical stage. And that brings us to the comorbidity, the existing of other medical conditions such as cardiovascular disease, diabetes, the age factor. Patients who are above 80 years of age have shown more morbidity towards um, COVID-19, and above 60 following the 80 years of age. The reason for many deaths in Spain and Italy because of its increased number of senior citizens. So age is seen to have been a critical factor here. And apart from this, diabetes also is a contributing factor, which can lead to making pushing patient from normal to severe or critical stage. Immunosuppressed patients such as cancer patients or who are receiving immune modulation therapies are also shown to have certain risk. In order, cardiovascular disease increases the risk factor as to 6 to 10%. Pulmonary disease, existing pulmonary diseases such as asthma or COPD gives 7.3% increase in risk, and diabetes a 6.3% increase in risk, and immunosuppression 5.6% increase in risk. All these adjoining risk factors are treated separately and symptomatically as they arises. So like I said, this is a very concise and a very brief presentation on COVID-19 and novel coronavirus 19. Please let me know if you need any further clarification or if you need any more detailed presentation on any one particular topic, because the epidemiology, the microbiology, and the clinical features, the treatment, the investigations are itself separate presentations by itself. So if you need any particular topic in detail, please let me know on the comments in your e-portal, so that I'll try my best to prepare such presentation and keep you updated in the future if possible. On that note, please take care, stay home, avoid going out as much as possible. Like I said, avoid contact as much as possible is the best way to prevent contracting this particular disease. Stay home, stay safe.